for joining us today. Excellent. I have two other team members who are joining us. Some of you may be able to see their faces popping up. I have Sasha Verdugo, who is a current BCBA in our team, and Carly Perlman, who was a former student in your program, was a supervisee with us, and is now a current BCBA on our team. As Allie mentioned, we can utilize the chat function for questions, or I'll open it up for some Q&A at the end. I'm going to start by just providing a little bit of an overview of our program. We are a community-based ABA program for individuals with autism. We serve individuals up through the age of 18, and some of the individuals that we serve do have dual diagnoses. So what that means is that they may have an autism diagnosis as well as another psychiatric diagnosis. It might be something like a bipolar diagnosis, a mood regulation diagnosis. It could be attention deficit. We see a wide range of other diagnoses in the clients that we serve. We implement a tiered service delivery model. So what that means is we provide services that are designed specific to the needs of the individuals, and we customize our level of intensity. So we have a didactic parent training model. We also have a focused parent training model, which utilizes more client-specific training with the parent, as well as an in-home ABA therapy model. We also have a family therapist who works as a part of our team, which is really fantastic because she's able to join with our families and really guide them through the treatment process and managing some of the things that families may be experiencing related to grief and loss or anxiety, and how those feelings that the parent has may impact their ability to follow through with our treatment recommendations. In addition, we also have clients that come to us that are follow along the more traditional ASD type of a treatment program. We also receive several referrals for individuals with severe problem behavior. So this looks like clients who might be at risk for hospitalization. They might be living in an out-of-home placement, group home, or therapeutic foster care, and they may be discharging from one of these placements. We receive referrals for clients who are discharging from a hospital setting, as well as discharging from other out-of-home placements, such as therapeutic foster care. This presents some really unique opportunities to not only design interventions to treat these challenging behaviors, but also for students to gain experience collaborating with the many service providers that are involved in these cases. This includes physicians. There are often several medication components that are interacting with some of the problem behaviors that we include that information in our functional assessments. High needs case managers, crisis support, group home staff, hospital staff, etc. Our program is situated within our outpatient clinic at Devereux, which provides several other opportunities to collaborate with other counselors who provide both individual and family counseling, case management, psychiatry, and primary medical care. All of those services fall underneath our outpatient program. So a little bit about our supervision experience. Supervisees are assigned to a supervisor, and you will meet with that supervisor at least twice a month. You are also assigned to a caseload, and your supervision experiences on these cases are going to provide opportunities for the development of skills related to the implementation of ABA, problem solving, learning challenges, writing treatment protocols, as well as curriculum development. We do emphasize building a caseload that provides a wide range of experiences. So this includes age ranges, programming, problem behaviors, unique care coordination opportunities for clients who might be receiving services from another provider, and we're working with that other provider. Our supervisees also receive supervision from other BCBAs through treatment overlaps and client-specific meetings. So the cases that you're assigned to might not be all cases that are overseen by your BCBA supervisor. There are also opportunities for periodic group supervision meetings, and these meetings take on a little bit of a different structure and focusing more on overall higher level skill development with respect to building confidence and a real solid knowledge of programming and treatment development. There are also opportunities to conduct group staff trainings. So we have weekly staff meetings where our whole team comes together, and supervisees have the opportunity to present really in as many of those staff meetings as they like on any topic that would be relevant to skill development for our staff. Once, obviously, our supervision is complete, there are, of course, post-graduation employment opportunities, and I'm happy to answer any questions about any of those components. I'm going to let Carly speak a little bit from the supervisee perspective, and then Sasha can talk a little bit more about the supervisor perspective as it relates to your experiences.
Hi, everyone. So as Michelle introduced me, I'm Carly Perlman. I'm a BCBA at Devereaux. I graduated from the Masters of ABA program with Adam and Dawn and all of those great people. Adam, what is that, 2 years now? I think 2018? I don't know. Everything blurs together now these days. So, so some fun things from a supervisee perspective. We are very, very team-oriented. There is no one idea takes all. We all work together very closely. I'm constantly reaching out to other BCBAs or supervisees on program development. So there's a lot of room for growth here, as well as support whenever you're feeling like you're stuck in a hard place, which is very comforting. There is a wide range of opportunities for program development across different types of skills. So maybe you have a client with severe deficits in language or social skills. Maybe they need more programming related to tolerating or desensitization protocols. Maybe they just need a lot of parent training. There's just a lot of opportunity to expand your skill set across those domains. There's also opportunities to learn a lot of assessments. So depending on the client, you might be trained in the Vineland, PEAK, VB-MAP, Brief, Essentials for Living. There's more that I can't think of off the top of my head, but social skill assessments, things like that. There's also frequent contact, which is different BCBAs. So when I first started, there was just Sasha and one other BCBA. Now there's technically 5 BCBA supervisors, but then you have Michelle, who's equivalent to like 20 BCBAs. So you get a lot of contact with Michelle, which is great. And then there's also just collaboration with other supervisees from other ABA programs. So we have quite a few supervisees right now that are in other programs from your guys' program, which gives you a really cool perspective as where you're at within your program, where they're at in their program, and how you guys can kind of help each other learn different skills and things like that. Good? Okay.
I mean, I don't know how much different that sounds on the supervisor side. I think it probably speaks more for Carly to say what you know, her experience was, and maybe Brian too. But like Michelle said, we do have, you know, at least twice a month, at least 2 hours of supervision with your assigned supervisor. But then outside of those times, if you're needed or you want extra, you know, we make ourselves available. Hopefully Brian can contest to that for us. I try, but you know, wherever your interest lies, wherever you want to learn or expand your skill set, we have a lot of those conversations, and trying to find those opportunities for you and make them for you is kind of the priority. If you are really into severe problem behavior, we'll try to find those caseloads for you. If you like those executive functioning, the social skills, if you like the intensive early intervention programs, we have all of those. And so letting us know kind of what you're interested in, we can help kind of mold your experience here at Devereux. Again, though, we do like to give you kind of a vast variety of clients. So, while you're interested in maybe one aspect or one area, we're going to make sure that you're well-rounded and you have experience with all these other things as well, because you're not going to have just a caseload of, a particular type of programming once you're out in the world of ABA, unless you're specifically looking for a company that provides that.
So we can go ahead and open it up for any questions at this point. I think I just wanted to emphasize one of the points that Sasha made, which is really focusing on developing a BCBA skill set for students. For once they go out into the real world, they will have the skill set to treat a wide range of learning challenges and problem behaviors, and wide range of programming skills. So really focusing on that well-rounded mastery of behavior analysis. Questions?
I have a question. Hi, my name's Tristan. You said you work with multiple diagnoses. Do you find yourself that there are dual diagnoses that are more commonly found together than others?
Well, you mentioned that. I could pull up our dashboard. We do have a organizational dashboard that does track all of our both psychiatric diagnoses as well as medical diagnoses. I don't have that information right off the tip of my fingers here right now, but I do know ADHD is very common. There are certain medical diagnoses I can speak to. I think that we just tend to interact with. There's obviously sometimes some GI issues, reflux related to feeding challenges. We have worked with a variety of clients that have seizure disorders. We've had a few clients that also have diagnoses of Down syndrome. And so I know I don't have the exact number, prevalence numbers for you, but those are some examples. We've worked with individuals that have had schizoaffective disorder, so they've experienced hallucinations in the past. And each of these cases presents different challenges and opportunities to design programming and to view those challenges from a behavior analytic perspective, particularly when you're interacting with other professionals that might not be coming at and viewing that disorder from the same perspective. I think that it is a skill as a behavior analyst to not only be able to evaluate something like that from a real analytical perspective as far as behavior analysis goes, but as well as opening ourselves up to what the perspectives are from other professionals and basically playing nice in the sandbox, because we're not going to be able to get our interventions accepted if we don't have buy-in from all of those other professionals. And so I know Carly and Sasha can speak to that. They have both worked extensively with individuals from varying perspectives with varying challenges. Any other questions? I think we might be out of time. This is really fast. All right.
Thanks for joining us.
Yeah, thank you.
Thank you very much for participating. We appreciate it. And like I mentioned, I'll probably be sharing just the main contact email address with the students after for any additional questions.
Absolutely. Thank you so much.
Thank you.
Bye.
Thanks, everyone.